Welcome back, everybody. There are many types of hair loss as well as causes, some of which can be prevented and treated. Joining us today is Dr. Jeff Donovan, who will walk us through everything we ever wanted to know about hair loss, what we can do to keep the hair on our head. Good morning.
Good morning. Thank you.
Let's talk about some of the causes and who it affects. It's men, women, and children.
It is. Hair loss affects everyone, and there's probably over 100 causes of hair loss, and so there's different types. In men, by far, male baldness, most common. In women, there are many causes, so hair loss in women, far more complex.
Okay, so we're looking at some examples of men right now, and it could start as early as their teen years.
It can. It can start as early as 8 or 9. This is male balding, starts in the crown, starts in the front, and then can join together, so it can affect the entire frontal and top of the scalp. But usually the back is spared where you don't get hair loss. But that differs from women. Women have a very different pattern of hair loss, where there's hair loss in the center of the scalp. The front usually is preserved where the hair is full. The back is full as well, but it's the middle that gets affected in women.
And there are many causes. Let's talk about some of them. You say it could be something like low iron. A blood test can fix it. That recently happened to me. We're borderline anemic.
That's right.
I was shedding my hair, and that's why.
So I think especially women, every female with hair loss needs blood tests. You want to know about iron levels, you want to know about thyroid, you want to know about anemias, but you want to know everything. You want to know how the hair is styled. Is there too tight of a ponytail? Is the heat excessive on the hair?
Too tight of a ponytail, can it cause damage and hair loss?
It sure can. Men and women, you know, tight ponytails, ballerinas, this is a common cause of hair loss.
Man buns?
The man bun is very popular nowadays. If it's relaxed every few days, not a problem. But if an individual wears hair tight for weeks, it can lead to permanent hair loss.
Is that right?
For sure.
So as much as you can, keep your hair down and relaxed.
The less you can do to your hair, the better. And that's a guiding principle for everything.
Shampooing, you say some people, if you don't shampoo enough, could be a problem.
For some people, that's right. There is a buildup of dandruff and seborrheic dermatitis. This can lead to redness and itchiness, a tendency to scratch. This can cause hair loss. So for those individuals, shampooing daily or every second day is the right answer for them.
If you want to suppress the hair loss because you see something starting to happen and it's thinning, go see your doctor, get a blood test like you said for underlying causes. Is there anything that works topically? Is there anything you can take that helps halt the process of hair loss?
There sometimes is, and it really depends on the cause. And so if someone has female hair loss or genetic hair loss in men, there are topical agents like minoxidil, there are hormone-blocking pills, there are laser devices that can be used nowadays, there's hair restoration, hair transplants, but it depends on the cause. And so if someone has low iron, they need to be supplementing with iron. That's the solution.
Internally.
A non-specific supplement that you can find on the shelf isn't the answer for someone with low iron or a thyroid problem.
Okay, let's take a look. I know you have some examples of some of the treatments that are offered. So if you could speak to what they are, how they work, who they're best suited for.
Sure. You know, there's a number of treatments that are available on the clinic realm nowadays. A popular treatment which has entered the clinic is a treatment called Platelet-Rich Plasma. This is a treatment that was originally used in orthopedic medicine to treat joint problems.
Okay.
We take your blood, we put it into this machine which is called a PRP machine, which spins the blood very quickly, and what comes out of the machine is a little portion of the blood called your platelet-rich plasma, and we inject that in the scalp. It has 17, 18, 19 growth factors that can help some people, not everyone, but some people. And so PRP is becoming increasingly prevalent in hair clinics.
Okay.
But one of the biggest changes has been in hair restoration or hair transplantation.
The plugs, they used to call them, right?
Yeah, plugs are no longer with us nowadays.
Okay.
You know, I always say to patients that if you have a hair transplant, no one should really be able to tell. And if someone comes up to you a year later and says, your hair transplant looks great, that's not a good hair transplant. Those days of plugs are over. But the hair transplant surgeon is now joined by an assistant. That's a robot. So robotic hair transplantation is now entering the clinics as well. There's a Health Canada approved robot which is able to extract the hairs from the scalp and very accurately allow us to remove hairs and put them in the areas of balding.
Is it painful?
It's done under local anesthesia, and with that local anesthesia, it's fairly comfortable.
Thank you. For all of this and more, just head on over to breakfasttelevision.ca. Great tips. Really
Thanks
great.
so much,
eye-opening. Right now, over to Kev.
Doctor.
Oh.
It was funny because I was, you know, we were talking about myths before and I made up some fake news that avocados will help stimulate hair growth. Lo and behold, I get a bunch of people on Twitter saying, I've heard avocados, almonds, salmon, eggs, and sweet potatoes actually will help with your hair growth. Was my fake news real news?
Was it real news?
Well, you know, I think these omega-3, omega-6 essential oils and fatty acids are good for hair. I don't think they're going to cause a lot of hair growth to come back, but they're good for hair, and they may help some of these treatments work better if you have adequate omega-3 and 6 fatty acids.
So it helps the hair that you have on your head look better?
It could, yes.
Kev!
There you go.